1. Which of the following is a common complication during pregnancy? A. Ectopic pregnancy. B. Appendicitis. C. Migraine. D. Osteoporosis. Rationale: ectopic pregnancy occurs when the fertilized egg implants outside the uterus, commonly in the fallopian tube, leading to serious complications if not treated promptly. 2. Which hormone is responsible for maintaining the uterine lining during pregnancy? A. Estrogen. B. Progesterone. C. Testosterone. D. Follicle-stimulating hormone, FSH. Rationale: progesterone helps maintain the uterine lining during pregnancy, preventing early miscarriage and promoting fetal growth and development. 3. What is the normal fetal heart rate range during pregnancy? A. 60 to 90 bpm. B. 90 to 120 bpm. C. 120 to 160 bpm. D. 160 to 200 bpm. Rationale: the normal fetal heart rate range during pregnancy is 120 to 160 beats per minute, indicating adequate oxygenation and fetal well-being. 4. Which of the following is a common sign of preeclampsia? A. Increased fetal movement. B. Hypertension. C. Weight gain. D. Reduced urinary frequency. Rationale: preeclampsia is characterized by hypertension, high blood pressure, after 20 weeks of pregnancy, often accompanied by proteinuria and other symptoms. 5. What is the recommended position for breastfeeding? A. Supine. B. Prone. C. Semi-reclined. D. Sitting upright. Rationale: sitting upright with good back support helps promote proper latch and positioning for breastfeeding, allowing the infant to feed effectively. 6. Which immunization should be administered to newborns shortly after birth to prevent infection? A. MMR, measles, mumps, rubella. B. Varicella, chickenpox. C. Hepatitis B. D. Influenza, flu. Rationale: the hepatitis B vaccine is recommended for newborns shortly after birth to prevent transmission of the hepatitis B virus from infected mothers. 7. What is the primary purpose of the APGAR score? A. Assess maternal vital signs. B. Evaluate fetal lung maturity. C. Assess newborn's overall condition. D. Monitor fetal heart rate. Rationale: the APGAR score is a quick assessment tool used to evaluate a newborn's overall condition and determine the need for immediate medical intervention or resuscitation. 8. Which of the following is a common developmental milestone for a 6-month-old infant? A. Rolling over. B. Sitting unsupported. C. Walking independently. D. Drawing simple shapes. Rationale: by 6 months of age, infants typically develop the ability to sit unsupported for short periods, demonstrating improved head control and trunk stability. 9. What is the recommended age for introducing solid foods to infants? A. 2 to 3 months. B. 4 to 6 months. C. 7 to 9 months. D. 10 to 12 months. Rationale: the American Academy of Pediatrics recommends introducing solid foods to infants around 4 to 6 months of age, when they show signs of readiness and can sit with minimal support. 10. Which of the following is a characteristic of sudden infant death syndrome, SIDS? A. Sleeping on the back. B. Sleeping on a firm surface. C. Presence of bedding or soft objects in the crib. D. Back sleeping position. Rationale: soft bedding or objects in the crib increase the risk of SIDS by obstructing the infant's airway or causing suffocation. It is recommended to place infants on their back to sleep on a firm, flat surface without pillows, blankets, or stuffed animals. 11. What is the primary purpose of prenatal care? A. To diagnose pregnancy complications. B. To monitor fetal development and maternal health. C. To induce labor. D. To administer vaccinations to the fetus. Rationale: prenatal care involves regular checkups, screenings, and interventions to ensure the health and well-being of both the mother and the fetus during pregnancy. 12. Which of the following is a common discomfort experienced during the first trimester of pregnancy? A. Braxton Hicks contractions. B. Constipation. C. Fetal movement. D. Increased energy levels. Rationale: constipation is a common discomfort during the first trimester of pregnancy due to hormonal changes and pressure on the intestines from the growing uterus. 13. What is the recommended position for a laboring woman to promote fetal descent and reduce back pain? A. Supine. B. Side-lying. C. Sitting upright. D. Trendelenburg. Rationale: side-lying position, particularly on the left side, helps improve blood flow to the fetus and reduces pressure on the mother's vena cava, promoting fetal descent and relieving back pain. 14. What is the term used to describe the expulsion of the placenta after childbirth? A. Lochia. B. Effacement. C. Episiotomy. D. Afterbirth. Rationale: afterbirth refers to the placenta and fetal membranes expelled from the uterus following childbirth, usually within 15 to 30 minutes after delivery. 15. What is the primary source of nutrition for infants during the first 6 months of life? A. Formula milk. B. Cow's milk. C. Breast milk. D. Water. Rationale: breast milk provides optimal nutrition for infants during the first 6 months of life, offering essential nutrients, antibodies, and immune factors to support growth and development. 16. Which of the following is a potential complication of breastfeeding for the mother? A. Reduced risk of breast cancer. B. Increased risk of postpartum hemorrhage. C. Improved uterine involution. D. Mastitis. Rationale: mastitis is an inflammation of the breast tissue commonly caused by bacterial infection, leading to symptoms such as breast pain, redness, and fever in breastfeeding mothers. 17. At what age should infants begin receiving solid foods as complementary feeding? A. 1 to 2 months. B. 3 to 4 months. C. 5 to 6 months. D. 7 to 8 months. Rationale: the World Health Organization recommends introducing complementary foods, along with continued breastfeeding, around 6 months of age to meet the nutritional needs of infants as they transition to solid foods. 18. Which of the following is a common developmental milestone for a 12-month-old infant? A. Crawling. B. Standing unsupported. C. Walking independently. D. Speaking in sentences. Rationale: by 12 months of age, infants typically achieve the developmental milestone of walking independently, demonstrating improved balance, coordination, and mobility. 19. What is the recommended sleeping position for infants to reduce the risk of sudden infant death syndrome, SIDS? A. Prone, on the stomach. B. Supine, on the back. C. Side lying. D. Sitting upright. Rationale: placing infants on their back to sleep is recommended to reduce the risk of sudden infant death syndrome, SIDS, by maintaining an open airway and minimizing the risk of suffocation. 20. What is the purpose of the neonatal heel stick test shortly after birth? A. To assess for jaundice. B. To screen for congenital heart defects. C. To evaluate hearing function. D. To obtain a blood sample for newborn screening. Rationale: the neonatal heel stick test, also known as newborn screening or the heel prick test, is performed shortly after birth to collect a small blood sample from the baby's heel for testing for various metabolic, genetic, and congenital disorders. 21. Which of the following is a common physiological change that occurs during pregnancy? A. Decreased blood volume. B. Increased heart rate. C. Reduced uterine size. D. Lowered respiratory rate. Rationale: during pregnancy, the heart rate increases to accommodate the increased cardiac output needed to supply oxygen and